Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, our topic is an innovative program to reduce substance use among adolescents. I speak to Dr. Terry Powell of the Johns Hopkins Bloomberg School of Public Health about Better Together. This is an outreach effort based in public libraries. Joining me and Dr. Powell is Diana Fortee Mason, one of the young people leading the program. Terry Powell, thanks so much for joining me to talk about the prevention of substance use.
Thank you so much, Josh, for having me today.
Now, I know you have done work in this area for a long time, and you have a much more thoughtful and complex understanding of what it means to prevent substance use than what a lot of people think of, which is like a poster of someone saying, don't do drugs. Is that fair to say?
Yes, that is fair to say. And I would also say that I'm also very much focused on young people who are affected by parental drug use. We know right now there's an opioid crisis ravaging our country. And many of those folks who are using opioids also have children. And no one is unaffected. So as we think about prevention, we should be thinking about prevention in a holistic sense. So not just one person, you not do drugs, but like, what is it going to take for that young person or that older person to decide not to do drugs? There will be some individual characteristics that are at play. There'll be family issues that are in play. There'll be community issues and societal issues at large that young people will have to navigate in when they are deciding whether or not they will use drugs or not.
So a lot of people look at all those serious challenges and say, like, how can we do anything, So sometimes people vacillate between, it's really easy, you just show people a poster that says, don't use drugs, or, oh, wow, what an incredibly difficult situation. There's a young person, there may be drug use in the home, a neighborhood with all kinds of challenges. How do you think about what can be done?
At all of those levels, the individual, family, community, society, there are assets that we can build on. So that is the approach that my team and I have been taking. How do we build onto the assets that already exist in communities? Because no community is just full of all that, right? And so for us, that's often been schools as anchor institutions, churches, and more recently libraries, which is where we're landing now. Libraries.
So tell me about the idea of using libraries as an anchor.
Right. So the libraries, they're located in urban, rural, and suburban areas. They are places where it's low barriers to entry. You don't need money to enter them, and they are full of resources. And what's been most impressive to me is that librarians are also really excited about the work of public health. We're in a school of public health, and especially here in Baltimore, the Enoch Pratt Public Libraries, they are amazing. They already have a social worker in the library program, lawyers in the library program. They are one of the first cities to now be, as city employees, to be trained on trauma-informed approaches. So, and thinking about with whom we could partner to do this very important work around substance use prevention, it seemed like an easy partnership to have with folks who are already on board with trying to help communities and be a resource for communities.
I'm going to turn to you now, Diana. How are you doing today?
I'm fine, Dr. Josh.
So can you just introduce yourself a little bit to the audience of people listening?
Hi, audience. My name is Diana. I am a 25-year-old Baltimore citizen. I grew up with a parent who got clean from using drugs when I was 2 years old. So I have some experience with the subject.
And you have been working with Terry Powell here to put together a program to help young people in libraries. Is that true?
Yes.
What have you been working on?
So our work has been based around the potential substance abuse for minors and adolescents and preventing that, and also helping to stop the drug use of their parents or guardians or adult people within their lives. And we basically hope to achieve that by partnering with different local libraries as a safe place to bring in youth, to create like an after school program so that they won't have to be at home or in a urban unsafe community, or they can just have something productive to do after school.
How do you go about connecting with, kids, adolescents who may be distrustful or, unhappy? How do you create that safe space for them?
Me personally, I have an advantage because I look very young, and I just come from an empathetic standpoint. So I try to approach it as if I'm not just an overbearing old person telling them don't do drugs. I try to look at it as like a friend just encouraging them that using drugs may not be the best option.
I mean, do you have a sense from yourself or your friends about the kinds of things that can help young people?
I guess growing up, most of the lessons that I learned in school that I actually learned and processed and received, it came from, a place of fun and excitement. So that's what we hope to bring. It's okay to have fun as a kid. It's not okay to use drugs.
I'm going to go back here to Terry Powell. You hear Diana talking about her hopes for this program. What do you think?
Diana is spot on. Our program is it'll be called Better Together, because that's our belief, like we are all better together. And it will require not just one person making the decision, but really our network of people making decisions and to support prevention, substance use prevention. And I agree with Dee. She and our other young adults really helped us think about like not making it feel like school. This isn't a school-based program, so it shouldn't feel like school. So we took their advice. We, of course, looked at all of the other evidence-based interventions, and we tried to really create something that was responsive to the young people that we had heard from, but then also, we built onto the knowledge that other people had already been providing.
And how will you assess whether this project is successful?
Right. So there are a few major outcomes, right? So this work is funded by both NIH and the Center for Prevention Research and Policy here at Hopkins. So the big thing is like, do we prevent early substance use? But also for us, some of the pathways to that are really like, have we increased the number of connections that young people have? Do young people now feel safe or know how to get to safety when they feel unsafe? Are they able to we have a best decision making model. Are they able to make the best decisions for them given the options that they have? And so those are also for us some of the markers that we want to be able to assess once young people have gone through this program and over time.
Great. Well, thank you so much to you, Terry, and absolutely thank you so much to you, Diana, for coming in and talking about this program. Good luck with it.
No problem.
Thank you.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.